A 42-year-old woman is having constant unprovoked orgasms that last up to 20 seconds and repeat at least 5 times per day. SO has Parkinson's disease. She just started a new medication 10 days ago and now her body is doing something that has never been documented in medical literature before. She makes an appointment, sits down across from her neurologist and explains what is happening. Early-onset Parkinson's disease at 42 is not rare, but it is not common either. Parkinson's disease destroys the neurons in your brain that produce dopamine. Dopamine controls movement, coordination, balance, and a very long list of other things we will get to shortly. Without enough dopamine, you develop tremors, muscle stiffness, slow movement, and so on. These are standard Parkinson's symptoms, so her neurologist prescribed Rasagiline, a widely used, well-studied medication which works by blocking an enzyme that breaks down dopamine, meaning more dopamine stays active in the brain for longer. The listed side effects of Rasagiline are dry mouth, flu-like symptoms, involuntary movements, and in severe cases, hallucinations. SO read these side effects and started taking the medication. 6 days passed without an incident. And just like God created Earth on day 7, so did Rasagiline create spontaneous orgasms. They appeared out of nowhere, 3 to 5 per day, each lasting up to 20 seconds. She had no history of hypersexual behavior or psychological trigger they could identify. At this point, nobody knows why this is happening. She is not on any other medications, so there's no obvious explanation. Her neurologist is stumped, so they do what doctors do when they are stumped. They run an experiment. They stop the Rasagiline for 2 weeks. Suddenly, the spontaneous orgasms stop. Then, in the name of medical science and also confirming the obvious, they restart the medication. They come back immediately. And also she comes back immediately, if you know what I mean. Now, the neurologist knows with certainty that the cause is the Rasagiline.
It really works! Oh my god, Khan! Yaar, ye tune kaise kar diya? You're a genius!
But the question remains, why? And the answer is dopamine. Once you understand what dopamine actually does in the brain, none of this is surprising at all, which almost makes it worse, in a way. Dopamine is not just a movement chemical. Dopamine runs the brain's entire reward and pleasure system. It is released during eating, gambling, exercise, cocaine use, sexual climax, all of those fun activities. When dopamine floods certain pathways in sufficient concentration, it can trigger the exact same neurological cascade as orgasm. The brain does not care where the dopamine comes from, it just responds. Researchers had already known this. There were documented cases of hypersexuality in Parkinson's patients on L-Dopa, which is another dopamine drug. There was even one previous case report of a man on Rasagiline experiencing spontaneous ejaculation. The breadcrumbs were there already. What nobody had documented before this woman was Rasagiline causing this specific response in a female patient. She is the first. Her neurologist switched her to a different medication. Suddenly, the spontaneous orgasms stopped. Her Parkinson's disease continued to be managed and she continued her life. This case was published not because it is funny, although it is in my opinion, but because it contains a real warning for neurologists. Dopamine medications for Parkinson's disease are some of the most neurologically unpredictable drugs in existence. You cannot target one dopamine pathway without affecting others. Compulsive gambling, hypersexuality, binge eating, and impulsive behavior are all documented in Parkinson's patients on these medications because the same reward circuitry that controls movement also controls all of those behaviors. When a patient tells their doctor something strange is happening after starting a new medication, the doctor needs to hear it. Don't be afraid to ask the uncomfortable questions. When prescribing any medications, doctors need to consider the potential effects on dopamine, because dopamine is essentially what drives us to do anything, and when we mess with it, it can lead to some serious outcomes. Thanks for watching, stay safe, and I'll see you next week. Goodbye.